Hypothyroidism. So what is this hypothyroidism? We said that hypothyroidism is an underactive thyroid condition. So now the gland does not produce enough. Remember, it's either it's producing a lot or it's not producing. If it's producing, it is hyperthyroidism. If it is producing little, it is hypothyroidism. So because of this, it's going to lead to slow metabolism, and we say that it is a common endocrine disorder that affects people of all ages, especially women and older adults. So please remember that that is under. So what are the causes? What can cause this? One of the major things you need to know is Hashimoto. Please, Hashimoto is very high yield in the exam as your causes of hypothyroidism. So Hashimoto thyroiditis. Another thing that can cause hypothyroidism is surgery. So when somebody have hyperthyroidism, then you do surgery or you do radioactive therapy, is going to reduce it. Another important one is medication. We are still going to look at this under mental health when we do mood stabilizer for medication for bipolar when patient is in the in the manic phase. So bipolar, we'll still do it in mental. You will see that one of the side effects of lithium is hypothyroidism. Then another thing that can cause hypothyroidism is iodine deficiency or excess. Then you have congenital. Some people are born with it. Then they can have pituitary or hypothalamic disorder. But for the purpose of exam, know your iodine, know your medication like your lithium, know your Hashimoto thyroiditis. They can cause it. Then another important thing is the what are the symptoms. Remember, when it comes to symptom of hypothyroidism, everything is slowing down now. So because everything is slowing down, their appetite will be low, their appetite will be very low, and they may even have constipation because everything is low. Everything is low. So the symptoms of hypothyroidism, they have fatigue, they have weight gain, they have cold intolerance, they have constipation, dry skin, depression, because when somebody is going through this, of course, they are going to be depressed. Okay. So, another important thing, what is the complications? The complication, it can lead to goiter. Remember that. It can lead to infertility. Everything is slowing down. Just use it that way to remember. Everything is slowing down. So, the next thing will be the complications of hypothyroidism: goiter, infertility, peripheral neuropathy, heart diseases due to high LDL. So, how do we diagnose hypothyroidism? When you are diagnosing hypothyroidism, the TSH, the TSH will be elevated. Then the T3 or T4 will be low. TSH, so that is how to compare it with hyperthyroidism. In hyperthyroidism, the TSH will be low in hyper, but in hypothyroidism, TSH will be high. So please don't mix it up. The TSH will be elevated. It will be elevated. Then the T4 or T4, T3 is going to be low. That is how to make a diagnosis. Then what is the treatment? The treatment is your synthroid, which is the levothyroxine. That is synthroid, levothyroxine. Please don't forget that levothyroxine. So levothyroxine is the treatment taken daily. They usually take it in the morning on an empty stomach. On an empty stomach. And it has to be taken lifelong in most cases, all their life. And the doses are adjusted and guided by when they repeat the TSH every 6 to 8 weeks initially, and then annually once it is stable. So again, let me refresh your mind where we started. Hypothyroidism. What is hypothyroidism? Hypothyroidism is a underactive thyroid condition where the gland does not produce enough, is not producing enough, or the thyroid gland is not producing enough thyroid hormones. So these are the causes: Hashimoto thyroiditis, thyroid surgery, medications, example like lithium. I said we'll still talk about that in mental health because it's a mood stabilizer. It's used for people that have bipolar in the manic phase. Then we have the iodine deficiency or SS. Then congenital hypothyro- hypothyroidism. There is another one. Then what are the symptoms? The symptoms. The patient may present with fatigue. Remember, everything is slowing down. Fatigue, weakness, weight gain, despite their normal diet, cold intolerance, constipation, dry skin, brittle hair. They may have depression, they're going to have bradycardia, and they're going to have menstrual irregularities. So, because of the menstrual irregularities, it can lead to infertility. Okay, so these are the complications if it is untreated. It can lead to goiter, infertility, peripheral neuropathy, heart disease, myxedema, coma. Then the TSH is elevated. Remember that the TSH is elevated, but in hyperthyroidism, the TSH is reduced, is decreased. That is the difference. Then the treatment, what medication do we give? We call it levothyroxine, also known as Centroid. They have to take it all through their life, take it on an empty stomach. They have to adjust the dose depending on the TSH level, and it has to be monitored weekly, then annually.